Hey everyone, and welcome. Today, we're diving into a condition that's way more common than you might think, but it's also dangerously misunderstood. We're talking about urinary retention. It's this strange problem that can either scream for attention or be completely silent, right up until it's a huge issue.
It's a simple biological function we just take for granted, right? But if you ever stop to think, what actually happens when that system breaks down? When the bladder just can't do its most basic job anymore? Well, that's the big question we're tackling today.
Okay, so it's really important to get this straight from the get-go. Urinary retention isn't a disease in and of itself. It's simply the inability to empty your bladder the way you should. You should really think of it like a warning light flashing on your car's dashboard. It's not the problem, it's the signal that something else, somewhere in the system, needs a serious look.
So here's our game plan for this explainer. First, we're going to look at the two very different ways this condition shows up. Then we'll go on a little hunt for the culprits behind it. After that, we'll uncover the silent dangers, see how doctors actually diagnose it, and wrap it all up with the key takeaways you really need to know.
First up, a tale of two conditions. And it's pretty fascinating, actually, how one single problem can show up in two totally opposite ways. One is this sudden dramatic crisis, while the other is a slow, sneaky issue that builds up over time.
To really get what goes wrong, we first have to understand what normal looks like. And honestly, it's a pretty simple two-step dance. Just think of your bladder like a balloon. Step 1, the balloon itself, which is a muscle, has to give a really strong, coordinated squeeze. And step 2, the knot at the bottom, the exit path, has to open up completely. That's it, a powerful squeeze and a wide-open exit. When one or both of those things fail, that's when you get retention.
And this is where you can really see the two different personalities of this condition. On one side, you've got acute urinary retention, or AUR. Bam! It's sudden, it's incredibly painful, and it is a true medical emergency. You feel this desperate urge to go, but nothing happens. Then on the other side, you've got chronic retention, CUR, and it's the complete opposite. It's gradual, often totally painless, and what doctors call clinically silent. You might just notice a weaker stream, or maybe a nagging feeling that you didn't quite empty all the way. One is a blaring fire alarm, the other is a quiet, hidden threat.
So, what in the world is actually causing this whole system to fail? Come on, let's play detective and find some of the usual suspects.
The causes usually fall into one of three main buckets. First up, simple blockages. Literally, think of a kink in a garden hose. For guys, the number one cause by far is an enlarged prostate, or BPH, that physically squeezes that exit path shut. Second, you have nerve problems. Your brain has to send a signal down to your bladder to tell it when to squeeze. If those nerve pathways get damaged from something like a stroke or a spinal cord injury, well, the message just never gets delivered. And finally, you have these other random factors, like some medications that can make the bladder muscle weak, or even the after effects of surgery and anesthesia.
And this brings us to the most critical part of this whole discussion, the silent dangers. This is where we really start to understand why that chronic, quiet version of retention is so incredibly serious. This quote right here, this is the key to understanding everything that happens next. See, when the bladder can't actively push urine out anymore, it stops being a strong, dynamic muscle. Instead, it becomes something else entirely, just a passive bag that keeps filling and filling and filling. So what happens when that bag, that reservoir, gets too full? The pressure inside just keeps building and building until it literally forces urine to leak out past the blockage. This is called overflow incontinence. And let's be clear, this isn't your typical leak. It's a huge red flag that the bladder has been stretched to its absolute limit and is failing. This slide shows the whole domino effect perfectly. It all starts with the bladder not emptying. That leads to it getting overstretched or overdistended. But the pressure doesn't just stay in the bladder. It starts backing up, all the way up the tubes that connect to the kidneys, causing them to swell up. And eventually, that relentless back pressure starts to damage the kidneys themselves, which stops them from doing their job of filtering your blood. This is how silent retention can lead straight to kidney failure. And the long-term consequences are no joke. That urine just sitting there is the perfect breeding ground for nasty, recurrent infections. The bladder wall itself can get weak and form these little pouches. And like we just saw, that constant back pressure can lead to kidney swelling, acute kidney injury, and eventually permanent chronic kidney disease. Okay. So with such serious risks, especially from that silent version, how in the world do doctors figure out what's really going on? Let's take a look at how they diagnose it.
Diagnosing retention is really like solving a puzzle. It always starts with a deep dive into your history, your symptoms, risk factors, medications. A physical exam can sometimes actually feel a full bladder from the outside,
But the real star of the show, the crucial piece of evidence, comes from something called a post-void residual, or PVR. It's just a quick, totally painless ultrasound scan of the bladder right after you try to go, and it measures exactly how much urine is being left behind. Finally, imaging, like a bigger ultrasound, can check the kidneys for that telltale swelling that shows there might be long-term damage.
Whew, we have covered a ton of ground. So, let's boil all of this down to the absolute most important things you need to remember.
First things first, acute retention is impossible to ignore. It hurts, it's sudden, and it's a trip to the emergency room, period. It's your body screaming at the top of its lungs that something is seriously wrong. It is a loud alarm.
But in total contrast, you have chronic retention. This is the silent threat. It can creep along for months, even years, with hardly any symptoms, all while causing serious, progressive damage behind the scenes. It's that quiet danger you have to be listening for.
Now, if you only remember one single thing from this entire explainer, please make it this. How you feel has almost nothing to do with what's actually happening to your kidneys. A lack of pain does not mean a lack of danger. In fact, the most dangerous form of urinary retention is often the one you feel the least.
And because of that, you just can't guess about this stuff. It's not something you can figure out on your own. The only way to know for sure what's going on is to get objective medical tests, like that bladder scan. So if you have any worries at all, don't guess. Get checked.
So we'll end with this question for you to think about. In life, we all hear the loud alarms, right? But the real challenge, and maybe the most important one, is learning to pay attention to our body's quiet signals before they turn into a full-blown crisis. Thanks so much for tuning in.